Harmony's a young mom of 7 children who wants a change, but she doesn't want to look overdone. Hear her story, see her results. Her breasts, her body, her turn. Hi, Harmony. Thanks for having me.
Hi, come on in. I'm hosting a neighborhood pool party, so please excuse the mess.
Oh, well, I'm gonna add to the fun and ask you 20 or so questions. Is that cool?
Yeah, sounds perfect. Come in.
How many children do you have?
I have 7 children. I have 3 of my own and 4 I inherited through marriage. We are the real-life Brady Bunch.
What are the ages of the oldest and the youngest?
My oldest is 13 years old, and the baby is 19 months old.
What is the best part of being a mom?
The best part of being a mom is teaching my kids to grow into kind and beautiful people. It's very rewarding.
I bet. What would you say is the biggest surprise about being a mom?
The biggest surprise is how much energy is required. Our house is literally the city that never sleeps.
So Harmony, we know the body changes after pregnancy. Would you mind if I ask you about yours?
Nope, go for it.
What would you say is your favorite body part?
Before pregnancies, it was definitely my breasts. They were round, full, and stayed where they were supposed to. After, not so much.
How so?
They seemed to drop and drop with each pregnancy.
Did that bother you?
It absolutely did. When you have something that was nice and it gets taken away from you, you're very aware of it.
Yeah, I bet. Did your pregnancies affect any other parts of your body?
Absolutely. My tummy became very wrinkly and saggy with each C-section. There seemed to be no amount of diet or exercise that would change that.
What made you decide to go ahead and talk to a plastic surgeon?
My breast kept slipping out of my bikini at the beach and underneath my bra at work. It was annoying.
I bet. Did you have any concerns?
I did. A couple of my friends had plastic surgery and the results were not something I would want. I didn't want to look overdone.
So how did you decide on your surgeon?
I Googled and read reviews about her, and most importantly, made sure that she was board certified.
What did you and your surgeon decide was best for you?
We decided on Natrelle Breast Implants along with a breast lift, and I also got a tummy tuck.
Did you tell anyone about what you had done?
Everyone, especially my mommy friends.
And what was their reaction?
They said go for it, and now after seeing how I look, they want it for themselves.
So how did you manage after your surgery?
After my surgery, my mom was a huge help. My husband also helped out tremendously. I really couldn't have done it without them.
Yeah, I bet. What would you say was the most difficult thing about your recovery?
The most difficult thing was not being able to pick up my 18-month-old daughter. Other than that, it was pretty normal.
What is the very first thing that you did after your experience?
Wore a bikini, of course.
What is the very first thing that you bought?
A lacy bra, one that actually fits.
And what do you think about the results?
I think I look fantastic. I'm really happy with the results. It's not too much, exactly what I would have wanted.
I've got to ask you, what does your husband think?
My husband thinks I look fantastic. He's happy that I'm happy. I don't shoo him out of the room anymore when I'm changing. It's been a great experience for both of us.
What advice do you have for other moms who are thinking about doing something similar?
That you're doing something just for you, and that's okay. When you're happy, your family's happy, and that's what it's all about. It's okay to make it your turn.
You look so beautiful. Moms, make it your turn today. Talk to a plastic surgeon and see what's right for you. You can also visit our website, itsmyturn.com, to learn about your breasts, your body, your turn. And be sure to use hashtag #MyTurn in your pictures on Facebook, Instagram, and Twitter when you share your new look.
Natrelle silicone-filled breast implants. Important information. Who may get breast implants? Indications. Natrelle silicone-filled Natrelle Inspira and Natrelle 410 shaped gel breast implants are approved for women for the following: breast augmentation for women at least 22 years old for silicone-filled implants. Breast augmentation includes primary breast augmentation to increase breast size, as well as revision surgery to correct or improve the result of a primary breast augmentation surgery. Important safety information. Who should not get breast implants? Contraindications. Women with active infection anywhere in their body. Women with existing cancer or pre-cancer of their breast who have not received adequate treatment for those conditions. Women who are currently pregnant or nursing. What else should I consider? Warnings. Breast implants are not lifetime devices and not necessarily a one-time surgery. Many of the changes to your breasts following implantation cannot be undone. If you later choose to have your implants removed and not replaced, you may experience unacceptable dimpling, puckering, wrinkling, or other cosmetic changes of the breast, which may be permanent. Breast implants may affect your ability to breastfeed, either by reducing or eliminating milk production. Rupture of a silicone-filled breast implant is most often silent and may not be detected by you or your doctor. You should have an MRI 3 years after your surgery and then every 2 years after that, for as long as you have your breast implants, to determine if rupture is present. If implant rupture is noted on an MRI, you should have the implant removed with or without replacement. With breast implants, a routine screening mammography and self-examinations for breast cancer will be more difficult. Ask your doctor to help you distinguish the implant from your breast tissue. Symptoms of a ruptured implant may be hard knots or lumps surrounding the implant or the armpit, change or loss of size or shape of the breast or implant, pain, tingling, swelling, numbness, burning or hardening. Tell your doctor of these symptoms and remove ruptured implants. Inform any other doctor who treats you of the presence of your implants to minimize the risk of damage to the implants. What types of conditions require more study? Precautions. Caution. Notify your doctor if you have any of the following conditions, as the risks of breast implant surgery may be higher. Autoimmune diseases, for example, lupus and scleroderma. A weakened immune system, for example, currently taking drugs that weaken the body's natural resistance to disease. Planned chemotherapy following breast implant placement. Planned radiation therapy to the breast following breast implant placement. Conditions that interfere with wound healing and blood clotting. Reduced blood supply to breast tissue. Clinical diagnosis of depression or other mental health disorders, including body dysmorphic disorder and eating disorders. Please discuss any history of mental health disorders with your surgeon prior to surgery. Patients with a diagnosis of depression or other mental health disorders should wait for resolution or stabilization of these conditions prior to undergoing breast implantation surgery. What are some complications with breast implants? Complications. Key complications are reoperation, implant removal with or without replacement, implant rupture, and severe capsular contracture, severe scar tissue around the implant. Other complications include asymmetry, nipple, breast, skin sensation changes, scarring or wrinkling, rippling. Talk to your doctor about other complications. Talk to your doctor. For more information, see the patient brochures at www.allergan.com/labeling/usa.htm or call the Allergan Product Support Line at 1-800-433-8877. To report a problem with Natrelle silicone-filled, Natrelle Inspira, and Natrelle 410 shaped gel breast implants, please call Allergan Product Surveillance at 1-800-624-4261. Natrelle silicone-filled, Natrelle Inspira, and Natrelle 410 shaped gel breast implants are available by prescription only.